have here with Miss Angela Day. She's an RN here at the Longest Student Health Center, and we're just going to go over some questions for her for the video. Okay, so the first question, I want you to briefly explain your career and what you do here at Mississippi State.
Here we're just on the nursing staff. We work and help with our doctors, work up patients, which is getting their vital signs and assessing them, getting their symptoms, their history, anything like that. All past history, surgeries, allergies, medications, things like that. Mainly just a lot of talking to them, you know, and then also patient education on the back end of it once they're seen by the doctor, anything that they may need, like if they need medication or a shot, and how we advise them on how to, you know, take the medication and, you know, if they need to be in, you know, not around people and stuff like that.
Okay. And the next question I have for you, what steps as far as education did you take to get here?
I actually went through first and got my LPN when I was like 21 in college. And then I went back to school and upgraded to my RN about 15 years later. So,
did you go to school and like get like a degree?
I have an associate's degree in nursing.
In nursing, okay. So you don't have to have like a bachelor's in like a science to be a nurse.
No,
you don't. Okay. And was it hard for you to take your I think it's what's the nursing test that you have to take?
The NCLEX boards.
I can't remember. It's some test you have to take to get like your license.
Yes. Yeah. It's hard.
It was hard. How did you prepare for that?
Well, I mean, school prepares you. When you're in nursing school, you have no life at all.
Yeah.
You just dive into it 100%. And then we did a review for about 3 weeks, and then I studied on my own for about a month before I took the test.
Yeah. And like, as for like, what advice would you give for me wanting to like go into being like an RN? Starting that, because people have told me like don't go to college and like waste 4 years. We can go like straight to nursing school or something like that. Do you think it's better for me to get a degree and then go to nursing school, or like just go from there?
It depends on how far you want to go. If you want to go past an RN and do nurse practitioner, you definitely need your bachelor's in science. The first 2 years of any college is going to be most of your just prerequisites for any field you go into. So those are always great to take, and you have to have all of those for nursing school, like your algebra, your English, your anatomy and physiology, histories, you know, electives, stuff like that. So for the first 2 years, that's great, and then you can find a nursing school. A lot of the BSN programs offer that through a 4-year program. So you're still getting all that. You're still graduating with a bachelor's in science, you know, and everything. So,
what's the most challenging part of your job?
Probably just time management, making sure that the patients are ready for the doctors to see, and staying on track, staying up to date, you know, making sure patients get out of here in a quick time so they can get to their classes or get to where they need to be, because everybody's got busy lives now.
Yeah. And like, this is another question, is it more challenging working with college students, or have you worked outside of college students before?
Yeah, I've worked outside. I've worked with geriatrics, pediatrics. I've worked with women's health for probably 10 years. I like it all.
Yeah.
So,
because I'm interested in being like a pediatric nurse.
Yeah.
So is it different from being like working with pediatrics and then working with like grown people?
Yes, definitely.
Yeah.
I mean, pediatrics, you definitely have to get on their level, and then you also have their parents to contend with, you know. So, you know, it's also, college kids are adults, and most of them are over 18, and, you know, they're able to make decisions. You know, kids, it's kind of hard to get specific symptoms out of them and stuff like that, you know.
Okay. Looking back, did you think, like, leaving out of high school, did you think that this would be the career that you were going to go into?
Yes, I knew that I wanted to go into nursing.
Okay, that's so cool. Okay. What keeps you motivated to continue to go to work every day?
I love it here. I mean, I really do. I love my coworkers. I love the doctors that we work for. It's a great environment. The college kids keep me cracking up. They're a lot of fun. And I mean, I just love it. The hours are conducive for my family life. I have 2 small kids, and I like the fact that I'm working 8 to 5 versus at a hospital working 12-hour shifts. And not seeing my family. So.
Were you ever like put like on the graveyard shift, as people would say, like working overnight?
Yes.
So you can.
That's very tough. Yeah.
Okay. What hospital did you work at? Did you work
At OCH.
OCH? Is that somewhere in Mississippi?
It's the one here in Starkville.
Oh, okay. I see. I'm not from here.
Okay, that's okay.
Okay. Last question.
Uh-huh.
What were some challenges and crossroads that you had to face, like getting to this point?
My biggest challenges was balancing a family and nursing school. Because when I went back to get my RN, I had a 5-year-old and a 7-year-old and a husband.
Mm-hmm.
You know, so I was expected to be a mother, a student, a wife, you know, but trying to keep everything wanted priority. So that was my biggest challenge in going to school, you know. So definitely I would recommend going to school before you settle down and have a family.
Okay.
But I mean, it works if you don't.
Mm-hmm.
I mean, it works. If you're dedicated, you'll get through it just fine.
Well, thank you so
You're
much for letting
welcome.
me interview